We're going to take a look at passive stretching to the lower body in supine, and we're going to start with a hamstring stretch. So to stretch the hamstrings, which are extensors of the hip, we're going to flex the hip. Body mechanics really important with passive stretching because you are holding the whole weight of a limb. So make sure that your client is shuffled towards the end of the bed so that you're not reaching over and breaking that chain at the hip or lumbar spine. You're then going to bring your client to end of range and then maneuver your body so that you can rest that leg on your body. Now, to stop this bend at the knee, because we want to target the hip, you're going to place the opposite hand above the knee, and that will allow you to help the client keep a straight leg. Once you get to that end of range, you're going to hold for about 30 seconds. If your client is restricted, quite restricted in range of motion, and you can see here that knee keeps wanting to flex, then you may want to target that insertion at the knee rather than the hip. And in that case, I would simply bring the knee and the hip to 90 degrees. So that's 90 degrees of flexion of the hip and 90 degrees flexion in the knee. And now I'm going to try and straighten the knee or extend it as far as it will go. So I hit end of range about here. Now, the leg is resting on my shoulder, and in order to move to that end of range, just watch, I'm starting with flat feet. Now, as I push into my toes and lift my heel, weight onto the front foot's flat, I can now hold that stretched position with ease, and that's a nice, strong, powerful position for you, the therapist. And simply hold that for about 30 seconds. So a lovely way to target the insertion at the knee end of the hamstrings. The next passive stretch we're going to look at in this position is the glutes. And remember, the glutes have fibres in many directions and are involved in many actions of the hip. So the first one is a hip extensor. We're going to bring that hip into flexion. Okay? Again, my body mechanics, feet are flat, I'm in a split lunge, and my lumbar spine is nice and aligned. I'm then going to push forward and transfer my weight onto the front foot, and my body is pushing through the foot, through the leg, his hip into flexion until I feel that leathery end point which tells me I'm at end of range. And I'm simply going to hold that for about 30 seconds. Next, remember the glutes go in all directions. So what I want you to do is palpate. We're going to simply perform some nice little circles of that hip, and we're going to find where that client's restricted. And definitely when I bring that hip into a little bit of abduction and flexion, this client has a restriction. So I'm going to hold it in that position for 30 more seconds. Again, you might find for a specific client that it's actually in a little bit of external rotation and a little bit of adduction where you want to hold that stretch. Remember, it should never be painful and it should feel good to the client. Now, again, circling round, as I said, some clients may feel it more into those rotators. And again, if we want to target, we can add a little bit of lateral rotation to the hip and bringing that hip across. So a lovely stretch to those internal hip rotators. And this is also a lovely one for the piriformis. So by taking that head of the femur away from the sacrum, we're getting a lovely pigeon type stretch into that muscle. And simply hold that position for 30 seconds. Now watch my body mechanics. Yes, one hand cupping the foot so that the leg is supported with ease. Opposite hand supporting the knee and hip so that it's not falling outward and my client can relax. So your client should be completely passive in this position. Now, split lunge, feet flat on the floor. I'm simply lifting that back heel, and that's creating the power to push forward and push that client into a stretch. And simply hold. The next stretch we're going to look at is for the abductors of the hip. So a little bit of glutes, glute median, also into that TFL and IT band. So I'm going to remove the pillow for this stretch. So knees up, remove the pillow, slide your legs back down, lovely. Place your pillow on a towel. Okay. Now I'm going to expose the leg that I'm going to bend for this client. Okay? I'm going to bring their leg up to 90 degrees. I'm going to bring their opposing leg towards the midline a little bit more, and I'm then going to lift that leg over and place it on the bed. Okay? So really important here that you support your client in that position. Next, I'm going to take the opposite leg, and this is the leg I'm going to stretch into those abductors. I'm simply going to lift that leg, keeping it in a neutral position, so keeping it level with the bed, and I'm in my squat stance here, and I'm simply going to bring that leg towards me. Now, I want to watch my client that I'm not rotating them, I'm not moving them off the bed, I'm simply looking for that leathery end point which says I'm at end of range. And then I'm simply going to hold that for about 30 seconds. A really nice position here, we can even treat both legs at the same time by adding a little bit of power forwards on that leg, backwards on the opposite leg, and simply holding. In supine, we can also stretch the hip flexors, generally the psoas, as the leg will be straight. But again, if you don't have time to move your clients into side lying or even into prone, then this is a nice way to get a gentle stretch through that hip flexor. Remember, there isn't much extension in the hip, so we're not looking to get a big movement into extension to feel that stretch. So, target leg, we're going to bend the opposite leg. Okay, so again, pillow is removed so that the leg can be straight. Now, I am simply going to bring this opposing leg into as much flexion as possible. And what you can see here is that that's dropping, it's rotating the pelvis round, and the opposing leg is dropping into extension. And just ask your client, so do you feel a stretch, and where do you feel that stretch? And they should feel that across the hip flexor region on the front of the opposite hip. A lovely stretch in supine now for the latissimus dorsi and also a little bit into the triceps. Okay, so important here that we stabilise the torso. So I'm going to take my client's arm and hook it around my arm. So make sure that they're completely relaxed and that they're trusting you to take their arm. Now, opposing hand, I'm going to stabilise that rib cage just to help me ensure that I'm taking arm attachment away from torso so that I'm getting that stretch rather than simply pulling on the arm, and as you can see that movement's coming right down to the feet. So I'm going to stabilise, shorten the arm and simply rotate my body away, bringing that arm into stretch. And you can just see that stretch coming right through the lat. So shorten, we're going to stabilise torso and stretch. And simply hold for 30 seconds. Some lovely passive stretches for the upper body, the neck in particular, targeting some upper trapezius and into the scalenes and that SCM, so looking at that lateral side bend and rotation. Okay, so important we remove the pillow so that we've got full control of the head, but make sure that you've got a good grip, so the whole head resting on your hand. Your client has got to feel safe, they've got to trust you to be able to let those muscles go and really let you get a nice passive stretch through there. So my stance, wide squat, so that I can move with ease, because we don't know where we're going to hold that stretch. It depends on where we find the restriction. I'm going to use one hand to stabilise the shoulder, and we can even use this to bring a little bit of stretch through those pectorals if someone's shoulders are quite tight through there and it's raised off the bed. And I'm going to push that shoulder gently away and then move the head into that position of stretch. So I'm going to stabilise that shoulder, opposite hand, bringing that head into some side bend, add a little rotation, rotate chin away, rotate chin towards, find where this client is stuck, and then hold for about 30 seconds. Okay. Targeting different tissues, you can sometimes see the line, you can see where the scalenes are on stretch as well as those traps. Again, depending on how much flexion we bring the head into will impact the muscles that we target as well. So don't forget to just lift up. So bring your weight up, straighten your legs and add some side bend, and now you can see we're getting right into the anterior fibres of that upper trapezius and more into scalenes. Again, holding for about 30 seconds. A lovely stretch for the sub-occipitals, those deep extensors of the head. And really it's just to bring a little bit of traction onto that occiput and help lengthen through those tissues. So I'm going to use both hands and do this unilaterally, coming right up the back of the neck and sinking into the base of the skull. So you can see where I am here, right at that occiput. Now, gravity and the weight of that client's head is enough to just bring that resistance to my fingers. And then I simply have to sit back in my squat to create a beautiful, beautiful stretch here at the back of the neck. You'll feel the tissue soften under your fingers, so we're getting that stimulus from the pressure as well as a stretch. And remember, just coach your clients to breathe. So targeting the tricep, the back of the shoulder here in this stretch. I'm going to take my client's hand and arm and simply place their hand on top of their shoulder. Now I'm in my split lunge, I'm going to take their elbow and I'm going to transfer my weight simply onto my front foot, stabilizing the torso and just bringing that arm into stretch. So you can see that stretch through the triceps here and simply hold for 30 seconds.